Have you ever felt like you're doing everything right for your health, meticulously taking those trusted supplements, only to quietly wonder if they're truly helping? Or perhaps, even doing more harm than good? It's a common feeling, isn't it? As we get a little older, our bodies change in countless ways, and what might have been perfectly fine for us in our younger years might not be the best choice now. The painful reality is, many of us assume that if a supplement is sold in a shop, it must be harmless, even beneficial. We see the glowing reviews, hear anecdotes from friends, and think we're being proactive. But the quiet truth is, some commonly used supplements could be subtly putting you at risk, especially if you're over 60, and even more so if you're already managing other health conditions or taking prescription medications. It's a little secret that isn't talked about enough. Certain popular supplements require a vital conversation with your doctor before you ever pop that first pill. The idea isn't to stop taking everything, but to empower you with the knowledge to make safer, more informed choices for your unique body. In this video, we're going to uncover 3 such supplements that are incredibly common, often recommended, but can pose serious risks to your health if you're over 60 and don't have a crucial chat with your doctor first. It's about being truly proactive and ensuring your health efforts are actually supporting you. Watch to the end for something that will truly surprise you about how much control you actually have over your supplement safety and how simple it can be to protect yourself. Let's dive right into the first one. A supplement that sits in many of our medicine cabinets, often hailed as a health miracle fish oil, or more broadly, omega-3 fatty acids. For years, we've heard about the incredible benefits of fish oil, its role in heart health, brain function, reducing inflammation, and even supporting healthy joints. And yes, in many cases, it absolutely can be beneficial. Omega-3s, particularly EPA and DHA, are essential fats that our bodies can't produce on their own. So we need to get them from our diet or, often, through supplements. They're fantastic for maintaining healthy cholesterol levels, supporting cognitive sharpness, and helping to keep those pesky aches and pains that come with inflammation at bay. It sounds like a perfect addition to any health regimen, doesn't it? And for many, it is. But here's where the conversation for those of us over 60 becomes critical. While fish oil is celebrated for its benefits, it also possesses natural blood-thinning properties. Now, for some, this might even be seen as an advantage, potentially helping to reduce the risk of blood clots. However, the delicate balance of our body's clotting ability is something that becomes increasingly important to monitor as we age, especially when we consider other medications we might be taking. Many people over 60 are on medications designed to thin the blood, things like warfarin, aspirin, clopidogrel, or other anticoagulants to prevent strokes or heart attacks. If you're taking fish oil alongside these medications, the combined effect can dramatically increase your risk of bleeding. We're not just talking about a little bruise here or there, although that can be a telltale sign. We're talking about a significantly higher risk of serious internal bleeding, nosebleeds that are hard to stop, or excessive bleeding from even minor cuts. Imagine the scenario: you're diligently taking your prescribed blood thinners and also taking a daily fish oil supplement, believing you're doing something good for your heart. Suddenly, you notice more bruising than usual, or a small cut just won't stop bleeding. It's a terrifying moment when you realize these seemingly separate health efforts might actually be working against each other, silently increasing your vulnerability. I've heard stories, and perhaps you have too, of individuals who've had routine procedures, like dental work or minor surgery, and faced unexpected complications due to excessive bleeding, only to discover later that their regular fish oil supplement, combined with other medications, was the culprit. This isn't to scare anyone away from fish oil, but rather to highlight the absolute necessity of open communication with your doctor. Before you start taking fish oil, or if you're already taking it, make sure your doctor knows your full supplement list, especially if you're on any blood-thinning medication. They can assess the combined risk and perhaps adjust dosages of your prescription meds, or advise on the appropriate, safe dose of fish oil for you, or even suggest alternatives. It's also vital to inform your medical team about your fish oil intake before any scheduled surgery. even a minor one, or a significant dental procedure. They might advise you to stop taking it for a certain period beforehand to minimize bleeding risks. Beyond medication interactions, consider your dietary intake of omega-3s. Are you regularly eating fatty fish like salmon, mackerel, or sardines? Are you incorporating flax seeds, chia seeds, or walnuts into your diet? If so, you might already be getting a good amount of omega-3s. And adding a high-dose supplement on top could push you into that risky territory without realizing it. A simple conversation with your doctor or a registered dietitian can help you understand your current omega-3 intake from food and determine if supplementation is even necessary. And if so, at what dosage? The goal is always balance and safety, not just piling on more pills in the hope of better health. It's about being proactive and informed, rather than reactive to unforeseen complications. So, before you reach for that fish oil bottle next time, or if it's a regular part of your routine, take a moment to pause and ask yourself if you've had that crucial conversation with your doctor. Now that we've shed some light on the careful considerations around fish oil, let's turn our attention to another pair of widely used supplements that many of us take, often without a second thought, assuming they're always beneficial, especially for our bones. Beyond the complexities of fish oil, let's talk about calcium and vitamin D, two nutrients almost universally associated with strong bones and preventing osteoporosis. As we age, maintaining bone density becomes a significant concern. And for good reason. Our bones naturally start to lose density, making us more susceptible to fractures. So, it's very common to be advised to take calcium, often with vitamin D to shore up those bones. And indeed, both are absolutely essential. Calcium is the building block of our bones and teeth, and it also plays a crucial role in nerve function, muscle contraction, and blood clotting. Vitamin D is like the key that unlocks the door, allowing our bodies to actually absorb that calcium. Without enough vitamin D, calcium might as well not even be there. For many, especially those who don't get enough sunlight or have dietary restrictions, supplementation can be vital. However, here's the often overlooked side of this seemingly perfect duo. It is possible to have too much of a good thing, particularly when it comes to supplemental calcium and vitamin D, and especially as we get older. Let's start with calcium. While it builds strong bones, excessive calcium intake from supplements can lead to a condition called hypercalcemia, which is essentially having too much calcium in your blood. This can manifest in a surprising array of uncomfortable and even dangerous symptoms. Imagine feeling persistent fatigue, muscle weakness, frequent thirst, or even experiencing bouts of nausea and constipation that just won't go away. These can all be subtle signs of hypercalcemia. More seriously, prolonged high calcium levels can lead to kidney stones, those incredibly painful little calcifications that can block your urinary tract. For someone already prone to kidney issues, this risk is significantly elevated. There's also ongoing research suggesting a potential link between high doses of supplemental calcium, particularly without adequate vitamin D, and an increased risk of cardiovascular problems, like hardening of the arteries. This is why a balanced approach, and knowing your individual needs, is so incredibly important. Many of us get a good amount of calcium from our diet already, through dairy products like milk, yogurt, and cheese, or fortified plant-based milks, leafy green vegetables like kale and spinach, and certain fish. Adding a high-dose supplement on top of an already calcium-rich diet can easily push you over the edge into unhealthy territory without you even realizing it. Now, let's consider vitamin D. While it's crucial for calcium absorption and has numerous other benefits for our immune system and mood, it's a fat-soluble vitamin. This means that unlike water-soluble vitamins, which our bodies excrete if we take too much, vitamin D can build up in our fatty tissues to toxic levels. This condition, vitamin D toxicity, is rare from food or sun exposure, but it can absolutely happen from oversupplementation. The symptoms often mirror those of hypercalcemia, because excess vitamin D leads to excess calcium absorption, nausea, vomiting, weakness, frequent urination, and kidney problems. In severe cases, it can lead to bone pain and even kidney failure. The key here is knowing your vitamin D levels. A simple blood test can tell your doctor exactly where you stand. Many people are deficient, and for them, supplementation is a lifesaver. But for others, who might have healthy levels from sun exposure or diet, adding a high-dose supplement could be counterproductive and even harmful. This is why a universal recommendation for a fixed dose of calcium and vitamin D for everyone over 60 just isn't appropriate. Your doctor can assess your bone density, your dietary habits, your sun exposure, and your blood test results to recommend a truly personalized and safe dose, if any is needed. Don't guess. Get tested and talk it through. Beyond the complexities of calcium and vitamin D, there's another crucial nutrient that, while vital for our body's functioning, can become a silent threat if taken without careful medical oversight, particularly as we get older. Iron. Iron is absolutely essential for our health. It's a fundamental component of hemoglobin, the protein in red blood cells that carries oxygen from our lungs throughout our bodies. Without enough iron, we can develop anemia, leading to debilitating fatigue, weakness, shortness of breath, and a general feeling of being drained. For some, especially women who are still menstruating or individuals with certain chronic conditions that cause blood loss, iron supplementation can be a lifesaver, restoring energy and vitality. It plays a critical role in cellular energy production, immune function, and cognitive development. It's truly a powerhouse nutrient when it's needed. However, for many people over 60, especially men and postmenopausal women, iron deficiency is far less common. And in fact, iron overload can become a significant and dangerous issue. Unlike some other nutrients, our bodies don't have an easy way to excrete excess iron. So, if you're taking iron supplements when you don't need them, that iron can accumulate in various organs over time. This slow, silent buildup can lead to serious damage to your liver, heart, pancreas, and joints. This condition, known as hemochromatosis, can be genetic, but it can also be worsened or even caused by unnecessary iron supplementation. Imagine unknowingly taking an iron supplement for years, thinking you're boosting your energy, only for it to be slowly and silently damaging your liver, leading to unexpected health complications later in life. The symptoms of iron overload are often vague or non-existent in the early stages, making it a particularly insidious threat. You might feel fatigue or joint pain, which could easily be attributed to aging, delaying a correct diagnosis until significant organ damage has occurred. Furthermore, iron supplements can interact with other medications you might be taking. For instance, they can interfere with the absorption of certain antibiotics, thyroid medications, and even antacids, making those medications less effective. This creates a cascade of potential problems, where one good intention inadvertently undermines another crucial treatment. The key takeaway here is simple. Never take an iron supplement unless it has been specifically prescribed by your doctor. After a blood test confirms you are truly deficient, a blood test for ferritin levels, which reflects your body's iron stores, is a much better indicator than just a basic iron test. If your ferritin levels are healthy, or even high, then supplementing with iron is not only unnecessary but potentially harmful. Most of us get sufficient iron from our diets. It's abundant in red meat, poultry, fish, beans, lentils, spinach, and fortified cereals. Focusing on these dietary sources is always the safest approach, ensuring your body gets what it needs without the risk of accumulation. So, before reaching for that iron pill, make sure you know your levels and let your doctor guide you. We've now carefully explored these 3 common supplements and the critical reasons why a conversation with your doctor is non-negotiable before you add them to your daily routine. Understanding these nuances is the first step towards truly empowering your health journey, and it brings us to a moment where we can reflect on the bigger picture of taking charge of our well-being. We've had an important conversation today, delving into the specifics of fish oil, which, despite its many benefits, carries a risk of excessive bleeding, especially if you're on blood thinners or heading into surgery. We then looked at calcium and vitamin D, crucial for bone health, but capable of causing hypercalcemia, kidney stones, and even contributing to heart concerns if taken in excess, reminding us that more isn't always better. And finally, we discussed iron, a vital nutrient that, if over-supplemented without a diagnosed deficiency, can silently accumulate and cause serious damage to organs like your liver and heart, particularly for those of us over 60. Remember, The goal here isn't to scare you away from supplements entirely, but to empower you with knowledge. It's about understanding that, as we gracefully age, our bodies become more unique, more sensitive, and our needs shift. What works for one person might not be right for another, and what was right for you at 40 might not be the best choice at 60 or 70. Your health journey is profoundly personal. The most powerful tool you have in your arsenal isn't a bottle of pills. It's an informed conversation with your healthcare provider. It's about taking the reins, asking questions, getting tested, and making decisions that are truly tailored to your unique physiology, your existing health conditions, and any medications you're already taking. Small, informed changes, like simply having a comprehensive discussion with your doctor about every supplement you're considering or currently taking, can make an enormous difference to your health and happiness. This simple act ensures that everything you put into your body is truly working for you, harmoniously supporting your well-being, not subtly working against you. The surprise I mentioned at the beginning is just this: the immense power you hold in making informed decisions. You don't need a secret formula or a complicated regimen. You just need to be your own best advocate and leverage the expertise of your doctor. I truly hope this has given you some valuable insights and peace of mind. What are your thoughts on this? Have you had experiences with any of these supplements? Or perhaps discovered an unexpected interaction yourself? Share your stories and questions in the comments below. Your experiences can truly help others in our wonderful community. We learn so much from each other. If you found this video helpful, please give it a thumbs up. It really helps us reach more people who need this vital, often overlooked information. And if you haven't already, consider subscribing to our channel. We're dedicated to bringing you practical, easy-to-understand advice, helping you navigate your health journey with confidence, clarity, and joy. You have the power to make informed choices that truly enhance your well-being and allow you to thrive. Here's to living your best life, feeling vibrant and confident at every age, and making every single moment count.